solutions. Thank you so much. It's that time of the day for our open clinic in YouTube. Today, we're going to go back to the popular and the most important concept in our community. We're going to look at fundamentals of ovulation and pregnancy. What do you understand by ovulation? What are the cardinal things expected to happen during ovulation? What is the role of ovulation in getting your family started? So this will be a very good opportunity for you to review your knowledge of ovulation, which is very important for anything to happen regarding starting your family. So this is what we're going to discuss today. Fundamentals of ovulation. So please, when you join, quickly introduce yourself. Tell me where you're located. Let me know who you are. So I need to know your name, and also I need to know your location. And it's going to be pretty straightforward and very simple. I will make it very simple so you will understand. And I'm actually going to start after this particular presentation. Please join me in our Facebook. I will repeat exactly this topic in our Facebook, but we have a bigger audience. When we talk about ovulation, ovulation simply means that particular time in the cycle of a woman when she will release the egg. Ovulation is when the ovaries releases the eggs, which is already inside the body of a woman. Every woman comes into this world with complete set of the eggs you will use to start your family. Now, ovulation is that particular special day when the matured eggs, which is carried in the follicles, will be released. Now, prior to this event, there are tiny finger-like projections. So if you notice, this end of the tube has some finger-like projections. Can you see it? It's called the fimbriae. So these finger-like projections will help to guide the eggs when they will be released. When the fimbriae helps the eggs to enter the fallopian tube, it will move towards the ampulla. The ampulla is where fertilization will occur. Fertilization is the union of the egg and the sperm to begin to form a baby. That particular process happens in the tube in a special place called the ampulla. Now, every month, the body of a woman is structured for pregnancy. Every woman. Now, the only difference is if you have gone into menopause, you will no longer have eggs. So you will not play in the process of becoming pregnant. But so long as you're within your reproductive phase of life, that's before menopause, every single month, your body is structured for pregnancy. There are a couple of complex processes that happen in the brain. There's a special place in the brain called the pituitary gland. The pituitary gland, the ovaries, and the womb, they all play role in setting a perfect environment for pregnancy to happen. The pituitary gland, especially in the brain, every month it will release a hormone. Pituitary gland is the master gland. So the hormone that is released in this part of the brain called the pituitary gland will control every other thing that happens in the body of a woman and a man. So the hormones that will lead to ovulation, pregnancy, maintaining everything about becoming a mother and a father is all controlled from the higher centers in the brain, in the pituitary gland. Now, this hormone will go to the ovaries. When it gets to the ovaries, it will tell the ovaries to start developing the eggs. Remember, you came into this world with the complete set of the eggs you will use to be a woman. Every woman, every girl child is coming into this world with her eggs. But those eggs will not develop until you're ready to become a mother. Now, the higher centers will produce the controlling hormone, which will go to the ovaries and tell the ovaries, you know what? Start developing follicles. But I want one dominant follicles. As the follicles grow, they will also start secreting an important hormone called estrogen. Estrogen is principally the female hormone. Estrogen is what makes you different from men. So as the follicles are developing, they will also start secreting estrogen. Now, the work of the estrogen is to start getting the womb ready. So it thickens the wall of the womb in preparation for pregnancy. About this same time, estrogen is being produced. Progesterone is also being produced. Progesterone is known as the pregnancy maintaining hormone. So progesterone and estrogen will start developing the cover of your womb to make sure it's adequately thick. Remember, when all these things are happening, it's assumed that the sperm would have come in, the eggs would have come in. Now, immediately after fertilization, there will be a couple of changes in the body. On day 7 of your cycle, remember the first day of your cycle is the first day of bleeding. On day 7 of your cycle, all the other follicles which are developing about the same time will stop developing, except one, which is called the dominant follicle. Dominant follicle will contain the egg, which will be released when ovulation happens. Now, this follicle will start growing and it will start nurturing the eggs within. As this whole thing is happening on day 12, so I wanted to mark day 7 and day 12. On day 12, the maturing follicles will burst open and release a lot of estrogen. Once estrogen enters your bloodstream, those higher quantity of estrogen, they will go back to the brain. When it gets to the brain, it will activate a release of a hormone we call luteinizing hormone. Now, I want everybody to pay attention to luteinizing hormone. You see, when you are worrying or wondering if you are ovulating or not, the medical terminology, the medical hormone that will help us to pinpoint if ovulation is actually happening, is LH hormone. Because once we have a sharp rise from that day 12 in your LH hormones, within 24 to 36 hours, ovulation will occur. So luteinizing hormone, it's the forerunner of releasing the egg. Follicular stimulating hormone is the forerunner of developing the follicles. Once your follicular stimulating hormone is working well with the higher centers, working well with estrogen, and your LH is okay, you will release your eggs. So right before ovulation, the eggs will burst open. Once the egg is busted open, it will be collected by this finger-like projection. So the essence of these finger-like projections is to pick the egg, scoop it into the tube. So I don't know how God plans things, but you can see our God is a perfect God. Once the egg gets to the tube, in that special place called the ampulla, it's expected that the partner would have deposited sperm inside the vagina, which will pass through the cervix, get to the womb, then begin the journey to the tubes. When it gets to the tube, the egg is already there. One sperm out of millions will meet that egg. Once everything is checked and everything is perfect, fertilization will occur. Once fertilization has already happened, there will further be increase in producing of progesterone. The higher level of progesterone and estrogen is what will make you not to bleed. The reason why a pregnant woman is not supposed to bleed is because everything has now switched. The body is now taking care of the baby already developing, because by the time it will start developing here, it will be called implantation. Once your baby has implanted about 12 weeks from ovulation, then possibility that you're going to be a mother is very high. So this is why we are careful, so that anytime you notice any form of bleeding, it's abnormal bleeding, we need to report it immediately. So once the eggs are inside the fallopian tube, there will be a lot of muscle contractions to put the eggs gently towards the womb. Once it gets to the womb, thank God, fertilization has occurred, pregnancy is ongoing. Now, if this happens, the woman will be pregnant. If there is no availability of sperm, pregnancy will not happen. Now, when pregnancy doesn't happen, when the body is ready for pregnancy to happen, what will happen next? The cover of your womb, which is called the endometrium, will disintegrate because pregnancy failed to happen. When it disintegrates, it will pass out from your body as your menstrual bleeding. This is the simplest way to explain this. So for every woman to become pregnant, to become a mother, you have to go through the process of ovulation. Now, some people might not ovulate because they have a couple of ovulatory disorders. If we discover you are not ovulating, we can give you ovulation induction drug, but it's not a drug you take by yourself. Unfortunately, some women might have what we call premature ovarian failure. When you have premature ovarian failure, it means you've gone into menopause before age 40. And once you've gone into ovarian failure, there is no longer eggs. And once you don't have eggs, you cannot produce anything. And once you can't produce anything, there will be nothing for the sperm to fertilize. So what will happen? You will not become pregnant naturally. You will need a donor egg. So the best time to believe and attempt for pregnancy in a woman that has a regular cycle, it's about 7 days before the ovulation. This is in a regular younger lady without any problem. But we don't encourage time lovemaking. But the best time for people that can pinpoint this, it's about 5 days before ovulation and a day after. This 7 days period is the so-called fertile window, fertility window. Very important and very straightforward process of ovulation. Now, there are a couple of non-specific signs in your body that might tell you you might. Watch the word might. It doesn't mean you are. It means might. Number one, increase in your cervical egg white mucus. So if you are conversant with your body, you will notice that about the day 12, day 13, day 14, you will notice an increased discharge, which is emanating from your cervix. It will look like egg white. This is why you need to be very friendly to your body. You need to actually make sure you know how to maneuver. This is one of the cardinal signs you might be ovulating. It's not specific. So not specific means you might have it and you're ovulating, or you might not have it and you're still ovulating. Some women will notice mid-cycle pain. Depending on the side the egg is going to come, you will feel some pain there. Some women will spot. Some women will notice bloating. Some women will notice increase in libido. The reason why you have increase in libido is because that's the way that God has structured for human beings to be made. This same thing happens in animal kingdom. When it happens in animal kingdom, it's called heat. So a female animal will be on heat and it will give some signals, which we call pheromones, to the male partner, so they will know they are ready to mate and they are ready to multiply their family. This is how families are made in animal kingdom. The same thing happens in humans. So about the time that the body knows the egg will be there, the woman will start having interest in meeting with a partner. Very important. We need to know this. Now, some women will not have any sign, but they are ovulating. So this is the theory behind our regular lovemaking. So whether you have the pain, whether you have bleeding, whether you have spotting, whether you have increase in your cervical egg white mucus, it doesn't matter. Just make sure that at any given time, you have availability of sperm so that once the egg is released, the sperm will get the egg fertilized. So a man, it's very important in the whole process of making babies. Women will always release their egg, but it's the duty of the man to make sure that he performs his civic duties, which is to make love to the woman regularly by making available the sperm. So this is where your efforts will come in. The woman will naturally release her eggs, but the sperm will mechanically get into the vagina to make sure pregnancy happens. It's not a one-time thing. I recently had a client that told me she made love once during her wedding night and she was wondering why she was not able to become pregnant. That's not how pregnancy happens. Some people, you need to make love even for 1 year, even when you have everything perfect. This is how to make babies. Okay? So that's my presentation this evening. I'm going to open the clinic and I'll give you an opportunity to ask your questions. This is the most important topic in our community. I started with ovulation. I have continued with ovulation. So many women can be proud to say, yes, Doc, I understand the concept of ovulation. Now is your opportunity to ask me any questions. So feel free. I can see Amara. I can see Tosi. I can see Tammy Too Sweet. I can see my COO, amazing lady. Guys, the clinic is open now. Start asking your questions. We have about 15 minutes. And it's beginning to look like Christmas. It's snowing. Okay? So guys, ask your questions. Let's go. This is the opportunity you've been waiting for. So feel free and ask your question. Evening, doc. Does nursing mother ovulate? Of course. It's even dicey in a nursing mother because a nursing mother might necessarily not bleed. Remember, part of the reason why women bleed, it's failure of pregnancy. But it's not all bleeding that means you are ovulating. So a nursing mother might not have started bleeding, but she has started producing eggs. This is why a nursing mother that is making love with her partner without protection can quickly become pregnant at 2 months after childbirth, at 3 months after childbirth. So yes, a nursing mother is ovulating, especially if she's younger than 35. So if you have a new baby and your partner is disturbing you for lovemaking, please be on contraception. You will likely get pregnant. And once you are pregnant in our community, nobody will advise you to remove your baby. You have to have that baby. We've had so many women that had a baby and within 2 months, they're already pregnant. And they will come to me and say, hey, doc, can I remove this baby? We do not remove babies in this group. We keep babies. So if you guys really want to go there, use protection. There are 13 different methods you can use. So the answer is yes. Okay, guys, keep asking your questions, please. Keep asking your questions. This is your opportunity. Use it properly, and the fewer the merrier. So the fewer people we have in the clinic, the better you will have opportunity to interface with me. Let me give you a secret. Anytime you see me showing up and you have few people in the clinic, you are actually having a free consultation. Something you would have paid a lot of money. Is a huge opportunity. If I were you, I will make the opportunity. So ask your questions immediately. Now, the next question from COO is very technical, but very important. Does ovulation guarantee pregnancy? Who can tell me the answer? Tosi, do you want to give it a try? Let's see if we can have an interactive session. Does ovulation guarantee pregnancy? What do you think? Tosi, I want you to give me a feedback. Amara, the same thing. Tammy, too sweet. Let's have an interactive session. Let it not always be, oh, Dr. Chudi is the one talking. Talk to me. Does it guarantee pregnancy? No. Why? Because it takes you to tango. There is actually no guarantee of pregnancy. This is a fact. Even in young couples, the woman is below 35, the man is young. Sometimes everything will be perfect, but you will not become pregnant. So there is no guarantee that once you ovulate, pregnancy will happen. There are complex factors that play a role in pregnancy, which can involve the woman, which can involve the man, and which can involve the both of them. So a woman might be perfect, ovulation perfect, hormonal level perfect, endometrium perfect, lovemaking perfect, but the partner's sperm is problematic. Can pregnancy happen if the sperm is problematic? No. A woman can have everything perfect. Ovulation, check. Cover of your womb, check. But the tubes are blocked. Can pregnancy happen? No. So depending on your own individual constitutional factor, depending on your medical situation, pregnancy might not happen despite the fact you are ovulating. So ovulation is just one aspect of the process of becoming pregnant. The process of becoming pregnant is complex. So when you ovulate, it is not a guarantee that pregnancy will happen. Okay? Correct. Chigozie Aneto also made a point. I'm not going to go into advanced mechanisms, but yes, sometimes fertilization will happen, but implantation will fail. This is why we need to be careful because there are so many things that can affect the process of pregnancy. So, like Chigozie correctly mentioned, sometimes egg good, sperm good, but fertilization and implantation will fail. Sometimes it might be chromosomal problem. Sometimes it might be endometrial problem. Sometimes it might be fibroid. Sometimes it might be big polyps. Sometimes it might just be hormonal imbalance. So anything that affects the normal structure of the womb, the normal structure of the female body can lead to inability of pregnancy to occur, despite the fact the egg is there. But the biggest factor that will lead to lack of pregnancy is actually ovulatory problems. The common denominator of pregnancy is ovulation. Without ovulation, no pregnancy. But there are other factors that will also play a role. Tosin is also asking a very important question. Does age has to do with ovulation? 100%. Remember, you have limited number of eggs. As you're getting older, they will be reducing in both quantity and quality. When you get to age 35, you will have rapid decline in the quantity and quality of your eggs. This is why when women get to 35, they are classified as advanced in maternal age. It means your eggs are reducing in quantity and quality, and you need to do something fast. You will not always ovulate. Once you have finished your reserve, you no longer have eggs. You go into menopause. So yes, age is very important. Age is the most important factor in a woman. Because once you are aging, you can't fix age. Age is not a disease. Everybody is going to age. So this is why we preach on you doing what you need to do based on your age. How a woman at 50 might become pregnant is not how a woman at 20 will become pregnant. A woman at 20 has about 90% plus chance of becoming pregnant naturally compared to a woman at 50. So as you're aging, your ovulation probability will be declining. So age is the biggest important factor in achieving pregnancy. Okay? All right. I'm loving the questions you guys are asking me. How can a woman with irregular period track her ovulation? Now, in our group, we encourage you to know about your ovulation. We encourage you to know about your cycle. We encourage you to study your body. But guess what? Like I mentioned, sometimes you might think you're ovulating, but you're not ovulating. There are a couple of different methods we can use to track ovulation out there. Increase in your basal body temperature, increase in cervical egg mucus, increase in libido. Now, there are some commercial testing strips you can also use to track your ovulation. When you're using all those commercial test strips, we are principally looking out for luteinizing hormone. When you are checking in the morning, when you have a rapid rise in your luteinizing hormone, it's a forerunner that in 24 hours and 36 hours, you will ovulate. But they are not foolproof. Some women will notice they are ovulating, but something will still happen. So that's the best way for a woman that has irregular period to track her ovulation is to use ovulation test kit. But whether you think you are ovulating or not, or you are not, our motto in this group is regular lovemaking. It used to be every 2 days, but since November, we encourage people to make love every day. The more you make love, the more you're increasing the possibility of becoming pregnant. Some women will not even know when they have ovulated, and you only have 1 day in a month to ovulate. Though some people can ovulate twice, depending on their cycle, but once you miss your ovulation, the egg will die within 24 hours, and you'll begin to look forward to another month. So this is why we don't take chances. I'm loving the questions. Okay? All right, guys. How accurate is ovulation test kit? I've already mentioned that. It's not foolproof. It can work. Sometimes it might not work. So it's not foolproof. So it's not perfect. It's not 100% reliable, but it can help in some situations, especially if you don't have any other medical problems and you're younger, then it might have some level of accuracy, but it's not perfect. How about using ovulation to determine the gender of a baby? Now, this is a topic for another day, and this is not the right way to determine the gender of a baby. If I understand you correctly, it's not to determine the gender, it is to have a particular gender, right? If you're talking about using ovulation method, I don't normally encourage it in this group because it's not reliable. It fails like 100%. The best way to to get a particular gender is to go for a special type of IVF, which if we have an access, you can get a PDF. We don't encourage that ovulation, timing, and all that for getting a particular gender. Personally, I don't encourage that. Anything that will waste your time, anything that will give you false hopes, I don't encourage that at all. Okay? All right, guys, we still have 6 minutes. Keep asking your questions. Make sure you share this video with your friends, especially your male partners, and also remember to subscribe. Remember to tell your friends. Remember to comment. Remember to like, and importantly, share. Share our YouTube handle. We have a new handle now. Share with your friends. Tell them to come. We have so many important videos. And if you notice, there is never a time you will show up in our clinic and you have a dull moment. Okay? Please keep asking your questions. Keep asking your questions. We have about 5 minutes, so you still have time. Quincy, good evening, Doc. Your question, a woman with one tube and the other tube is little. Hold on. One tube and the other tube is little. What do you mean by little? I don't understand what you mean by little. Now, the problem with the tubes. Personally, I prefer completely blocked tubes. If the tubes are completely blocked, we're gonna feel bad. Some women are gonna cry. Some women are gonna feel bad. Oh, it's only IVF I'm gonna go through to become pregnant. We will say yes. The problem with partial blockage of the tube is ectopic pregnancy. So some women might have partial blockage in the middle. This side is not blocked. The side the sperm will come in with is not blocked. The sperm will come in. The egg will manage to come in. Both of them will meet. Embryo will be formed. Fertilization has occurred. But because of that blockage in the middle, pregnancy will continue to develop in the tubes. A condition that is deadly we call ectopic pregnancy. So personally, when we are assessing you for infertility and we check your tubes and they are bilaterally blocked, I will feel bad, but I will be comforted that we will rule out the possibility of natural pregnancy. It will not be nice to become pregnant naturally and it's a ectopic pregnancy, because guess what happens in a ectopic pregnancy? Most of the times, we are gonna cut off that tube. When we cut off that tube, you're left with one tube. So if you are unfortunate, but you're still around, we have to thank God. If they told you that your two tubes are blocked, go and shop for money and go for IVF. This is my only concern with tubal problems. Okay? All right, let's see what we have. Good evening. You have gestational diabetes in your previous pregnancy. You are currently pregnant and you're still having gestational diabetes. Could it be a thing to worry about in the future? Now, here's the deal. You probably, as of now, you've developed frank diabetes. Gestational diabetes is a type of diabetes you develop during pregnancy. Now, if you had gestational diabetes in the past, it's expected that when you deliver your baby, your blood sugar level and insulin will normalize. But if your blood sugar and insulin level continues beyond the delivery of your baby to be high, then you might have graduated into frank diabetes. So it's possible that based on the outcome of this second pregnancy, you might no longer have gestational diabetes. You might actually have full-blown diabetes. Now, thankfully, every pregnant woman is going to be subjected to a particular test we call OGTT test, oral glucose tolerance test. Oral glucose tolerance test is a very important test that all pregnant women must go through. The reason why we run that test is to rule out diabetes. So once we are not okay with the level of sugar in your blood, then we will treat you as a woman that has diabetes. The danger of having diabetes in pregnancy is a couple of complications in the baby. Majority of women that have diabetes in pregnancy will deliver very big baby, which we call macrosomia. And those babies might have problems moving forward because handling of sugar in the body of a baby is very important for the baby to survive outside your body. So what you need as a matter of urgency is to make sure you are under a very important high risk pregnancy specialist. And we have all these services in this group. The only problem I've noticed in our group, most of us are very smart. You will not come when you're pregnant. You probably might be managing it. You will not register for your ANC until you begin to have problems. You begin to bleed. You begin to have contractions. Then you begin to run up and down to get something fixed. We have a platform for all pregnant women to interact. There are certain things that will freak you out in pregnancy and you begin to seek help. There are certain lifestyle modifications you have to adopt in pregnancy. So these are all the dividends. So Lillian Mbello, if you're pregnant in our group, it's expected you would have been in our Telegram group. So we can guide you and see what we can do for you. Okay? Now, some women might have independent gestational diabetes. So that means anytime they are pregnant, their diabetes will be showing. Once their pregnancy is over, their blood sugar level will come back to normal. All these things are going to be determined by your doctor. My clinic time is over. I've spent about 30 minutes. Let me see. One tube is blocked. The other tube is almost blocked. So you have partial blockage in one, then you have complete blockage in the other. I'm afraid you might be a candidate that might eventually have ectopic pregnancy. Okay? All right, guys. Thank you so much. My next clinic in YouTube will be on Saturday. But if you have our handle in Facebook, please join me in Facebook immediately. I will give exactly this topic in Facebook. Then we can get some break. Tomorrow is my normal clinic, 12 p.m. Eastern Time, US. 6 p.m. Nigerian time. We'll spend about 30 minutes. So tomorrow I'm going to find a good topic. We talk about it and we'll see what we can learn. Until then, thank you for coming. And please come back again on Saturday. God bless you and bye-bye.